Adami Ipeli, a former employee from Baffin Fisheries, got sick while being out fishing near Newfoundland back in May. It first started with what he thought was a stomach ulcer. He says he was in a lot of pain and stayed days in bed before he asked to be brought back on the land, and the captain then called a doctor.
He called the doctor, he called me to the bridge, and he made a call to a doctor, and he spoke for me. I mean, by rights, I was the one in pain who had the symptoms. I should have been on the phone with the doctor so I could give him symptoms and let him know what was going on with me, right?
Chris Flanagan is the CEO of Baffin Fisheries. Questioned about that case, he says that all captains are trained first responders, and employees are allowed and afforded the opportunity to speak with a doctor. Referring to reports, the company get after any health incidents.
I can't speak to an individual's medical care, but I do know we get their logbooks, and I do know that so far this year, there's been no breach of protocol. We've looked at these logs and seen that the patient and the first responder were there on the call. Now, whether the patient spoke or not, I can't say.
On that call, the doctor told the captain that there was no need for the patient to seek medical on shore. But things got worse when Ipeli found blood in his vomit.
It was just unbearable, though, at most times, right? There was a point where I puked blood and reported it to the captain, and all he just said was, "Puke blood, did you?" And then he walked away from me.
Ipeli says he lost around 18 pounds during his stay on that boat because he wasn't able to eat and spend most of his time in bed.
I think when somebody gets sick with illnesses and stuff, they really need to change, start taking that seriously more, right? Even if they have to lose 3 days of fuel, I mean, it's only money. Money comes and goes. They really need to change their policy better, brought up to speed. I mean, there's some captains that say if you're sick, you have to work sick, right? The old fishing mentality is what it is.
Flanagan says that doctors' advice are prioritized and followed. He says the company recognized that historically the industry has existed with an intergenerational type of training regime, where fishermen used to learn from other fishermen on board.
We do have training programs, of course, but we're in the process of strengthening them and really rethinking the whole concept that exists out there, and making sure we break down those barriers for fishermen who may have grown up learning on the job and known only learning on the job. We have to address that and make significant improvements there, mostly to make crews safer.
Back in Iqaluit, Ipeli has done multiple visits to the health center where a doctor performed blood tests and a CT scan. His health problem is still unknown. Cardinal, CBC News, Iqaluit.